Hi guys, welcome back to my channel. It's been a while. It has been a while, guys. I have been locked in, and as you see, the topic of today, what it's about, I really had to lock in and focus on this NCLEX. So I'm here to give you guys some tips and the material that I used and how I was able to pass my NCLEX on the second attempt with 85 questions. Who know me would know. I have been an RN, qualified back in 2005 in the UK. I actually trained in the UK as an RN, and I worked there for about 18, 19 years before coming to Canada. And if you know, you know, in the UK, you don't need NCLEX to practice as a registered nurse. Once you go through nursing school and everything in the UK, the exam that they need you to do is the OSCE. So I didn't have to do NCLEX at all in the UK. So when I moved to Canada, I literally moved here as a PCA. And guys, I am grateful, but PCA job, it's hard. It's a very hard job, I must say. It's very difficult. And I think I have mentioned this in one of my previous videos. I really, 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 really applaud PCA workers because it's hard. It's a hard job. It's challenging both physically, mentally, and emotionally. It's draining. It's hard. It's a hard job. If you don't love nursing, you will not be able to cope as a PCA because it's a hard job to do. I have been working as a PCA ever since I've entered Canada. When I first came, my husband was saying to me, you've got enough knowledge, you should go and do the NCLEX and blah, blah, blah. So when I first came, I studied for maybe about a month or so. I didn't study for long because I didn't think that, it would have been that hard. So when I came in 2024, I attempted, when I came in 2024, I decided I'm going to try, and I did. I used Renar at the time, and I used Bootcamp. Okay, those were my two resources that I used. I used Renar for content, and I used Bootcamp for my question bank. I went to the whole 150 questions on my first attempt. The whole 150 questions on my first attempt. But I think my downfall was I had work up until 11 o'clock that night, and my exam was 8 o'clock the following morning. So I think that was my downfall because I was really, really tired during the time doing that exam. I was so tired. So I think that also contributed to me failing the first time. However, saying that, this time around, guys, I was in and out of that exam room within 2.5 hours. As you guys know, it's a 5-hour exam. And I went in after 8, 10, and I came out after 11. So I spent about 2.5, maybe 3 hours the most. And I don't think it reached 3 hours because when I left, my clock was still 2 hours and something on it. I finished on good timing as well. And I even had a break. I used the bathroom during that 2 hours timing where I did my 85 questions. Okay. When I saw my last question at 84 questions, I knew that I passed. When I saw the question, I knew that I also knew the question. And guys, I would say one thing, and I don't know if everybody or anybody has had that feelings or have these feelings, but NCLEX is hard. It is a very hard exam. But when the questions were coming to me, it was off the back. It's like I knew. It's like I had case studies, and it's like, okay, I know this. Okay, I know this. So I was able to answer my case studies. And if you're doing case studies or if you're studying at the moment, you would know that sometimes with the case studies, based on the topic that they're doing, sometimes it will give you the progress notes and it will tell you like what the doctor has planned. So that alone as well actually give you an idea that, okay, I've answered the previous question for that case study right, or I've answered it wrong. And most of my case studies, when they do the review plan for the patient, I could have seen that the answer that I choose were in correspondence with the care plan. Okay, so that actually boosted me as well, and was actually motivating me. So when I saw my last questions on the 84, and it was at 84, and I saw the last questions, I thought it is going to cut off at 85. I just knew it was going to cut off at 85, and it did cut off at 85. When I saw the computer closed at 85, I actually, tears come to my eyes, because I just could not believe that, I passed this NCLEX. That's how I felt. I passed this NCLEX. I just said, thank you, God. I passed this NCLEX. I'll tell you guys something. One thing that we need to do throughout this process is pray. Pray to God. Pray and ask God for support. Ask God for clearance, because without God, we can't do anything. Okay? So without me, before I go on babbling, let me show you guys the resources that I use. So I used Renar. I'm sure a lot of you guys would have heard from her. I am not affiliated in any form with Renar. Okay, I'm just sharing the content that I use. Okay, so I used Renar. This was the first book that I did. I did it twice. Okay, for content. And the reason why I did it twice for content, because if you know, I trained in the UK, and with your training in the UK, basically you specialized when you reach your second year. Okay, I specialized into adult nursing in the UK. So I didn't nurse pediatrics, I didn't nurse mental health, and I did not nurse maternity. So and the NCLEX exam is based around everything. It's around all the areas. Okay, so you have to know your maternity, you have to know pediatrics, and you have to know mental health, and then you have to know adult, of course. Pharmacology, you have to know, right? So I did this book twice. Yeah, I did this twice. Okay. I printed it out. And this is the workbook that Renar actually gives to you with her program. Okay. So I use this book for content. I use Renar for content, and this was the book that I did. This was the first one, and then I repeated that book. I repeated her programs a few times. And this is the second one. It's the same. It is the same as this. It's the very same book. However, this one has got less pages because I did both sides copy. This one I just made a mistake and copy and do it on each page. Okay, but as you can see, and if you look through in this one, you would see some of it I did not follow out, because some of it I did not do. Actually focused on the areas where I know that I will weak. Okay, where I know that I will weak, and where I know that I really needed the content for, which was maternity, mental health, and pediatrics. Okay, I knew that those were my weak areas, so I use this information, right? I use this information, and I focused on those areas. Okay, I also have the remediation book, as you guys know. This book came out in December. I also had this book. I haven't pulled it out, but I went to all the classes that she had on YouTube, and I was following that. Okay, what I have also got quick facts. This book is my baby. Sometimes I sleep with this book on my bed, because as I get up in the morning and before I go to bed at night, I go through this book. I read through this book. This book is content. This book is content. It doesn't have everything in it, but it's got what you need for the NCLEX. Okay? And the program that I used for My question bank was Naxlex Naxlex NCLEX-RN. Okay, that is what I used. All right, for my question bank. Okay, I had in total, I had 3,000. And again, I repeated that. I did that twice. Okay, I did that twice. I had 3,752 questions in total, mixed with next gen questions. Was also included in this. It's got case studies. It's got everything that you need for the NCLEX. This program, I don't think it's actually spoken about enough for internationally educated nurses. I don't think this program here is stressed. This question bank, especially, internationally educated nurses. This question bank here is the best. It is the best that I have tried, because I have tried boot camp. I have tried archers. I have tried Remar's question bank. Remar question bank is good, but it did not resonate with me, I'm afraid. Her question bank just did not resonate with me. Her content did. Her question bank, I did not focus on her question bank at all. Hence, I actually went for Naxlex. Okay. Archer, I know a lot of people praises Archer and a lot of people uses Archer. When I did it the first time, I had used Archer and Bootcamp along with Remar. Maybe I had used too many of them at the same time. I don't know. But for me, Archer's explanation for the questions, after you do your question bank, when you go back and you do your review, to me, is very complicated when you're reading it. And for me, I don't like complicated stuff. I like to get straight to the point. So for me, Naxlex is the best one for that, because with Naxlex, it gets directly to the point, what it is, directly to the point. They also has got videos that you could look at, and they have got live teaching. They have got live teaching every day with different professors and nurses. So, and it's all included in your package. It's highly, highly, highly recommended. You could actually speak to the lecturers during the lecture. You could get involved. They do questions with you. You can answer the questions. So it's highly recommended. As I say, for internationally educated nurses, Naxlex is the program for you. Naxlex is the program for you. Take it from me. I did my NCLEX yesterday and I passed with 85 questions using Naxlex question bank. And another thing is that I know a lot of people say, or I know some people say, some of the programs, they tell you, do not concentrate or don't focus on question banks. Guys, question bank and doing questions is definitely needed, because this exam, it's a 5-hour exam. Okay, it may sound like a lot of time, but when you sat in front of that computer and you have to read that question, and the nervousness with you, sometimes you don't get it straight away. You have to read it. Sometimes I actually find myself yesterday reading over that question. Sometimes I read over the question, especially the case studies. I read my case study, okay, and then I go to my question that is asking, and then I go back to the case study, and I was looking at what is it really asking me. And I think, and that's where you need to focus on. What is it really asking you? Okay, it's very important to focus on that, because sometimes you read a question and it's very vague. So unless you actually settle down and ask yourself, what is the question really asking? You would choose the wrong answer. It's easily done. Okay, so practice question banks so that you can have your time managed and you can able to go over your questions in your exam over and over and over again if you have to. All right, if you have to. Okay, so that's my tips for anybody that's actually for anybody that is taking the exam at the moment. Internationally educated nurses, I know a lot of us, our training is completely different to what they do in Canada, America, maybe Australia. Okay, so it's very important for us to focus on the areas that you're not sure about, and then go back into your question bank. And what I did as well when I was actually doing my question bank, I would literally do the questions, and then whatever I got wrong, I would go back, revise those questions, write them down. I've got notebooks. I didn't bring my notebooks to show you guys. Let me show you guys as well. Let me just show you guys. Yeah. So you see, donkey ears. Donkey ears, guys. Donkey ears, we call them in Trinidad. First, it's been used and overused. But guys, notes. I used to take notes. So I used to go back into the question bank, write them down, write down my notes, highlights. Guys, it has been a tough few months, and this is just one book. Okay, that is just one book. This is my other notebook here. This is my latest one. All in the back of the paper, I'm right. All in the back of the notebook I've been writing, taking notes. Okay, because as you can see, I am not a young person. I have been out of nursing school now for over 21 years. So for me to go and take exam and pass it on 85 questions, you could do it as well. Okay, make up your mind, put your head down. If it means you have to cut off everybody, do that. My strategy, you know what my strategy was? I'll tell you what my biggest strategy was. On the first attempt when I did my exam, I told everybody, when they asked me, I told them I pass. I told everybody that asked me, I said I pass. Because you know why? I didn't want people coming and asking me, when are you doing your NCLEX? When are you doing your exam? When are you going to be an RN again? I didn't want that, because that's distraction. So I had to cut off some people, put my head down in my book, and just focus. All when people call me and say, oh, you're sitting on your computer and you're just clicking on it. You're just sitting on your computer all day, just clicking. What are you doing on your computer? Blah, blah, blah. Nobody knew that I was studying for my NCLEX, really studying for my NCLEX. Okay? So if you have to do that, put your head down, cut off people, cut off going out, cut off linemen. I can tell when last I've been out. I cannot tell when last I have been out, you see. So this book ends here, you see. Right? This is all the notes that have been taken. I used to go through all the questions that I don't know and then write them down, write down what I don't know and go it over and over until it's sinking. Because this is not an exam where you can cram. It is not an exam where you could cram. This is an exam where you have to know content in order to pass this exam. You have to know content in order to pass this exam, because you get case studies and you have to know the diagnosis of these case studies and what is asking you, okay, and the treatment that you need, okay, the treatment that you need to provide for these patients. So you need to know whether whatever your doctor is instructing you to do, whether it's the right thing, whether it's the wrong thing, where you need to challenge, where you need to question. This is where your critical thinking comes in. This is where it comes in, where you need to be assertive enough to say, okay, like when you're on your unit and your doctor come and prescribe you 200 grams of digoxin and tell you, give it to a patient. You wouldn't just go and give that to a patient, would you? You would question that. Okay? So this is where the NCLEX. This is where what the NCLEX is looking for, where you are able and whether you are able to say, I cannot give that, or why am I giving that? Or could you review this medication that you have prescribed? Or this procedure that you're asking to perform, is it possible for you to review it? All right. So this is what the NCLEX is literally looking for. Do you have the capability of doing these things? All right. So know your content, do your reviews, and you will be fine. Once you know your content, the NCLEX becomes easy when you face it. Okay. And most of all, don't forget the most important thing, the Bible. Pray. Pray. This is one of my favorite psalms. This is one of my favorite psalm. It has been my comfort. It has been my comfort. Yes. Okay. So I would leave you guys with this, and I would say good luck to anybody that is actually planning to take the NCLEX at the moment. I would say good luck, lock in, cut off what you have to cut off, make the sacrifice, and do your NCLEX. Anything else after you finish your NCLEX can fit into place. Okay, that's a very important exam once you want to be an RN, or if you are an RN and you've, like myself, I was an RN in the UK. I left the UK and I came here to Canada, and I've been working as a PCA, and I knew that I wanted to be an RN again. So I made this sacrifice. Even where I live, I actually give myself a secluded area that I have got no distractions. Okay, I've got no distractions. I was able to lock down, lock in, and study. All right. So thanks again for watching. Please like, share, and subscribe. Somebody might benefit from this video. And I'll see you guys in my next video. I know it's been a while, but I'm back by the grace of God. Thank you guys for watching.